Good morning. Good morning. Welcome to the Mahogany Circle of Hope Show podcast. My name is Ameedah Hasan, and I am one of the co hosts of our show. The other co host is Miss Gloria Bryant. Gloria, would you love to say good morning?
Good morning, everyone. Thank you for being here. And we really thank our guest, Bill, for being here with us today.
Thank you, Gloria. Bill, you want to say good morning also?
Good morning, everyone. My name is Bill Harrison, I've got my son Levi with me this morning. He's my
Hi,
Oh,
Levi.
okay.
out
Hi,
of my
Levi.
hi out of my six agents. He's my number one go-to. So
Okay.
you
All
know,
right. Welcome. Welcome to you both. Welcome. The
Bring him in
Mahog.
more, Bill, if
Yes,
you
go ahead.
can.
Say
I
what,
was just going
Gloria?
to say, bring him in more so we can see him too, if he
Yeah,
can
yeah. Levi can
be a
can
part
be
of
here
it.
too. Yeah, we've seen him out with you in the community, and he's learning the ropes, and I'm sure he's just as knowledgeable as his dad. So yeah,
pretty sure.
so yeah, so audience, we have father and son. We have Levi and Bill Harrison here this morning to enlighten us about Medicare and the updates. We usually start out with our mission statement and Mahogany Circle of Hope Tacoma. We are a nonprofit cancer support group with support meetings and supporting those going through cancer. But for our show, our mission statement is the Mahogany Circle of Hope show is to uplift, inform, empower cancer survivors through heartfelt conversations, practical wellness strategies, and a community first approach. We are also dedicated to information and resources, and that's why we have different guests, different professions who can come on our show and enlighten us and inform us so we can have great health and wellness in our community. So we are excited to have Bill and Levi. We've known Bill a long time. He's in the community supporting the senior population and making sure that we are update on health insurance and the new, if anything that's new that's going on that's going to affect our lives. So we'll go ahead and get started with our show today. Gloria, you want to lead us on in to our
Yeah.
interview today?
All right. Thanks again, Bill, you and Levi, for being on the show. I'm going to start out by asking you if you could just tell us a little bit about yourself. We know, but we want the public to know also.
Well, good morning, everyone. My name is Bill Harrison. Um, I've been in the Medicare industry for about 10 years as a Medicare broker. Just recently, and within the last year, I opened my own agency. I have six agents that work for me now, and my son is my number one out of those six. He's definitely the go getter. He's out there in the community a lot more than the rest of them.
Awesome. Awesome.
Yeah.
So before I started in the Medicare industry, I spent about 5 years running clinics for Franciscan. I've also worked for some of the local home doctors and community engagement. So I worked with a lot of adult family homes, assisted livings, and seniors
Hmm.
in general. I'm also a member of the Adult Family Home Council as a vendor and have been for 10 years.
Awesome.
Also a member of the Assisted Living Council for the last 5 years. Um, Also, life member of VFW, Disabled American Veterans, AMVETS, American Legion. I've got life on all of those now. Um, so I'm a Army combat vet, and sorry I'm looking a little scruffy. I'm been going to
That's
PT. I got two brand new knees I'm working on. Um, and I
That's
got
all
two
right.
children. I have two children. Levi's my oldest, and then my daughter is going to school in Wisconsin to become an occupational therapist. So
Oh,
awesome.
she's working on her doctorate. Uh, so that's pretty much me in a nutshell.
Okay. Awesome.
okay.
Awesome.
What was it about the Medicare program? Can you tell us a little bit about the Medicare program the history and who began this program?
Yes, ma'am. It was actually signed into law by President Johnson. But before that, Harry Truman and his wife were big. They got it going. They had the ball rolling by the time President Johnson got in and signed it in. Let's see, July 30th, 1965.
Oh, wow. Okay.
And Medicare is a federal health insurance program for folks that are over 65 or on long-term disability or kidney failure or ALS.
Oh,
So there's
wow.
I have a lot of clients who are not 65 who are on Medicare.
Okay.
And actually, uh, ex-President Truman and his wife Bess were the first two to get their Medicare cards.
Is that right? Oh, wow.
Little piece of trivia.
Yeah, that's good to know. That's good to know.
Do we pay into the benefits for Medicare? How does that work?
Well, when you're working, you do pay into the Medicare, and it's what it is a payroll tax, and it's 1.45%. But you pay that, and then your employer matches that. Or if you're self-employed, you pay a 2.9% tax, and if it's over, I believe it's over 200K, it's a 0.9 something on top of that. But you do pay into it. And actually on Part A, you have to have what we call 40 quarters. And basically what that is 10 years worth of consecutive working, contributing to that tax to get your Part A for free.
Mhm. Okay,
10
that's good
years?
to know.
Yes, ma'am. Yeah, there's a lot of folks that get short on that. They come up with like 31 or 32 quarters, and next thing you know, they're like, "Why am I paying so much? I'm paying for my Part B premium, which this year is 202, and then they've got Part A premium on top of it because they didn't work the 40 quarters."
Oh, wow. That's
Oh,
good to know.
And the only way to avoid those penalties or paying those things is by having Medicaid in conjunction with Medicare. But that's a whole
that's
different
Yeah, it
critter.
is. Yeah, it is. Yeah, it is. Wow. I'm glad you made that distinction. And see, okay. So your employer and you are the contributors financially into the Medicare program.
Yes, ma'am. Unless you're self-employed,
Okay.
then it's
All
all
right.
in you.
Okay. That's good to know. What age is it mandatory for you to enroll in health benefits for
Well,
Medicare?
for Medicare, that's a tricky question. That's 65 is the age you're supposed to start. But if you're continuing to work, I recommend you only start the Part A, which you've already earned. Don't start the Part B because most of those folks who are working have employer insurance.
Right.
So there's a delayed portion on that. And I actually have paperwork that I send folks all the time. They're like, "Hey, I just called you because I'm starting Medicare." I said, "Just start your A. If you're still working, we'll worry about that next year or the year after when you decide to retire." And then we got forms to send your employer that the HR has to sign off on that says my employer insurance ends at this date. I'd like to start Part B.
Okay.
I have a question. Can I just ask this real quick?
Oh,
Yes,
So,
sure.
ma'am.
Go ahead.
so Bill, if oh shoot, I don't forgot. So the longer you work for Medicare, does that mean the more benefits you have? Like
That's all.
if you don't stop working some people can stop at 62 or 65. So if you go on to 65, between 62 and 65, do that give you more benefits that
No, no, on Social Security, yes, but on Medicare, no.
oh, okay. I'm getting it, yeah, mixed up. Okay, gotcha.
That's a Social Security. That's another big critter by
It
itself.
sure is. It
We
is.
might have to bring
It
you
is.
back on that one then. Social
Yeah, it
Security,
is.
yeah. It's like,
Uh,
whoa.
And if you
Bill.
do retire at
Oh, go ahead.
62, you can't sign up for Medicare until you're 65. So just keep that in mind that you won't
Mm.
be able to sign up for the Medicare until you turn 65 if you're not working and you're not disabled
Yeah,
or on
unless you're retiring
dialysis.
early for a disability.
Yeah.
Oh,
Okay.
okay. That's good to know.
Yep, yep. Bill, so define what is part A, what is part B, and what is part C.
I get one easy question out of this whole deal, huh? Well, part A is hospitalization. And that's
Okay.
the one we mentioned. You got to have 40 quarters to get it for free.
Okay.
Part B, that's your primary care doctor and any outpatient surgeries you may have.
Mm-hmm.
We're going to skip C. We'll come back to it. We're going to
Okay.
go down to D, and we're going to say D stands for drugs because it's easier to remember than prescriptions.
That's true.
And then we'll come back to C. C by itself is Medicare Advantage plans, and they
Okay.
cover A, B, and D for the
Okay.
most part, unless you're a veteran. And then there's some Medicare Advantage plans that don't include drug coverage because they don't want to mess up your VA coverage, things like that.
Mm-hmm. Okay.
Have you heard of I'm getting the Medicare Patriot?
Patriot plan, yep. There's
Uh-huh.
that's United's veteran plan.
Mm-hmm.
Uh, Humana has one also. That's called an honor plan. Aetna has one. It's called an Eagle. WellCare has one. It's called a Patriot as well. There are several different veteran plans out there, and that's probably a whole conversation by itself too. I do a lot of VA because I'm VA myself,
Mm-hmm. Mm-hmm.
um, but there's some plans out there that give them back money on the Part B. That most of them don't include drug coverage because the VA or TRICARE is taking care of their drugs. But most folks, like if they're a retiree on their TRICARE for life,
Mm-hmm.
well, they make them pay that $66 a month to Delta Dental, and most of these plans have dental on them, so most of those veterans can drop that Delta Dental bill every month. So it's a good deal. Yeah,
Mary
Oh,
had a
what?
question in the chat.
go ahead.
Um, do all doctors accept Medicare?
No, they do not have to.
Oh wow.
And
Okay.
that's one of the things I've rarely see one that doesn't accept Medicare.
Mm-hmm.
But if they do accept Medicare, that then they're obligated to, like the folks who have what we call Medigap or supplements, F,
Oh,
G,
okay.
those some they're obligated to take those if they do. Um,
Okay. I'm
Well,
glad you clarified that. But back to um veterans and dependent wives and widows with the TRICARE. I was curious about that. How does that fit in with Medicare? You know?
well, there's okay. If you're in service at the time, you have what we call Tri-West. Once you age into 65, TRICARE for Life makes you take Medicare, so you have to pay
Oh,
that
okay.
202 a month because
Okay.
you have to take it to keep your TRICARE for life.
Okay.
Uh, so uh, that's whoever's enlisted or in service and the spouse.
Okay.
Now that's TRICARE for life. Now VA disability is a total different thing,
Okay. I'm
and
glad you
that
okay.
and that's where I'm at. When you're 100% disabled veteran, uh, your wife has what we call CHAMP VA, which is a little bit of coverage, but I see a lot of 100% disabled veterans
Mm-hmm.
not start their Part B, and what happens is they get in trouble down the road.
Oh boy.
If they end up in a facility or in a home and they can't go see the doctor out at American Lake or uh, Madigan, then they're in trouble because
Mm-hmm.
they have to start that Part B, and there's a 10% penalty a year for not having that Part B.
And see, that's what that was gonna be my next question. Because my cousin had a situation in California, and she said, well, the lady told she said she didn't want Medicare, but she said they're forcing me to start it, to enroll it, and she said that they're going to penalize me, and I'm gonna have to pay some money if I don't enroll. And I didn't know that is a requirement that you
It,
connect some
it,
kind
it,
of way with it.
it
Wow.
is a requirement to start that Part B if you don't have any other coverage. Now, what kind of rubs me the wrong way is that 100% disabled veteran, he does have coverage. He has 100% coverage through the VA, but they
Mm-hmm.
don't count that towards Medicare, and it's very, very
Oh,
frustrating.
oh,
Because
okay.
I'll get folks who are veterans who end up in an adult family home, and next thing you know, the family's calling me saying, "Hey, we got to start Part B for my mom or my dad,"
Mm-hmm.
and I'm like, "You're not going to like this because what should have been 202 a month is now going to be $600 a month
Oh
because
boy.
they never signed up for it and they
Mm-hmm.
got a penalty, it's extremely frustrating for me as a veteran.
Mm-hmm.
Um,
Mm-hmm.
the
Have
only way
another
to get out of that is to go down into Medicaid.
Wow. Okay.
I have a
Wow.
question, Bill.
Yes, ma'am.
I'm back to the dental.
Okay.
So if you have Delta Dental
Mm-hmm.
and you also have dental plan through your like United Healthcare,
Yes, ma'am.
so you can drop that Delta Dental because I mean they say well, okay, it's $4,000 a month. It gives you that. I mean a year for your dental, but help me out.
I you're going to hear the insurance guy say something he probably shouldn't say. Um, I am not a proponent of these dental plans.
Mm.
You never get your money back out of it.
Do that, but you end up
If you
paying.
start doing the math, you're better off taking a care credit program through that particular dentist
Mm-hmm.
or spending on your credit card than you are because you quite frankly you never get your money back out of it.
Wow.
And that's why I've been in the industry 12 years now, 10 as an independent, and I do not have one dental program. I like the dental that's on the free dental that's on the Advantage plans. But as far as Delta Dental, and a lot of folks have asked me, and I'm just like, well, hey, pencil it out because you won't get your money back out of it.
Well, at least you
Yeah.
being honest about that particular company, cause
Well, it's all of them.
oh wow.
I just don't. I
That's
don't have a
supplement.
I don't have a problem with Delta. I just
Mm-hmm.
the dental
It's just
insurance.
a supplemental one. Yeah.
Yes, ma'am.
Mm-hmm.
Well, that's
It,
good
it,
to know. Or they'll be dropped today. So, okay.
Well,
but that's good to
we
know.
just saved you $67 a month. So
Yeah, you did. I need that.
That's good to know. So back up, you said the care credit plan. Is that what you said?
yeah, some of the dentists have care credit programs,
They do. Yeah.
and they actually you do
You
better on
say we'll
those.
come out better if we go that route.
Yes,
Because my
ma'am.
business has that too, because when it's something real big, like a root canal, that's
Yeah,
what they'll say. You need to fill out the application and do this if your insurance is not going to pay for at least 80% of what you're doing. So
correct.
I'm glad to know that. Yeah, I'm glad to know that. Um, how oh, supplemental, since we talking about that, how does supplemental coverage work? You know,
Well, it depends upon the coverage. Are we talking from the VA standpoint? Or are we talking?
no, from
General,
the
just general.
general,
Okay.
like United Healthcare and what's the other one, Humana
Oh,
and
well, on
all
the
them.
Medicare Advantage programs, on those
Yeah, how
Medicare,
does that work?
they have
Yeah,
networks.
okay.
Yeah, they have networks, and most of those programs, um, especially the veteran programs, don't cost you anything. So, but like if we're talking about supplemental in the form of uh, a Medigap program, like the G or the F, those are all lettered programs. Uh, those have no dental or no vision on them.
Okay.
And then if we're talking about it from the aspect of original Medicare's got about $600 worth of cleaning one time a year. That's all the dentalist got. And then on the vision, the only time you get a pair of glasses is if you have cataract surgery. They give you one free pair. So
Oh, wow.
original Medicare has very little in the way of supplemental benefits.
Okay. Okay. It,
It
it's it's
seems
kind
like
of
you're
complex,
forced.
you know? Yeah.
It seems like you're forced to take a supplemental, though.
Either, well, if you want, we'll take my mom. I have her on a supplement. It's a Plan G. And right now, Plan G is a Cadillac. And she's a retired teacher with controlled income, and she can afford a Plan G. You know, not everybody can afford, 200 and what's hers, 260 a month now. But
So that's the top of the line.
yeah, that's the G is the Cadillac. It used to be F, but now
Okay.
it's G.
So G would cover everything that your
Well,
regular insurance
there's
don't.
a caveat to that too. It does cover all your medical visits, but you also have to meet that. There's a deductible every year of 283, so you have to get that out of the way before it starts paying for everything. But at the same time, G is a Cadillac, but it doesn't have any dental or vision on it.
Wow.
So then there you go.
Yeah. Yeah. Mary says some people do not understand the PPO versus the HMO. Can you explain the difference?
I can. Here in Washington, if you have a PPO, you don't need a referral to go to any provider. HMO, you do need a referral from your primary care. And that's the basic difference. However, what we're seeing is the PPOs is starting to slowly go away. Like we'll take multi-care. They don't accept any PPOs anymore.
Yeah, that was messed up.
But if you ask me, you get better care through the HMO because there's more communication between your primary and your specialist.
I think so too. Because Kaiser is a HMO, right?
Mm-hmm.
And that's who I have. I'm a retired government worker, but I've had Kaiser just about all my life through my marriage. Even when my stepfather had us on that. And then when I started working for the government, I just went with Kaiser too. Because I think for multiple families, husband and wife with kids and stuff, I think the HMO is the best way to go because it covers everybody in the family. And I still think it's beneficial even as a one person senior. It's like one stop. It's not divvying out, well, the lab, I got to go over here to the lab and they getting their cut.
Well,
Then I got to run over here to the specialist and then he getting his cut.
There's more
So
communication in the HMO.
yes, and they all,
And
yeah.
they've seen and it's proven better outcomes from
Oh,
the
really?
HMO. Yeah. Now,
Okay.
originally when the PPO came out, it was meant for rural counties, folks way out in the middle of nowhere. That way they could just go wherever because it was easier because you got this doctor takes these plans and that doctor takes these plans, and that seems to be that's been our greatest hurdle the last 2 years has been networks. This plan may fit that client, but if that client has one doctor at Franciscan and three specialists in multi-care, they got to make a decision.
Yeah, yeah, yeah. I can see that. Yep, I can see that. This topic is so complex, and it's so much information to try to process. Go ahead, Gloria.
What about dealing with patients that have cancer? Is there a special plan for them or?
There are some special plans out there, some supplemental plans. There's some hospital indemnity plans that have cancer policies. Medco has some cancer policy. Combined Insurance has a cancer policy. There's a lot of different ones. I haven't really got into that part, but if somebody needs something when we're doing our needs analysis one-on-one, then we look at that. I mean, a lot of them have caveats in there though. You can't have had cancer and then get a cancer policy,
Oh, I see.
or they
Okay.
have a timeline. Yeah, it's
But Medicare, do that pretty much cover? I mean, are they pretty good about covering cancer patients?
they are good about covering the patient. And it depends upon what part of Medicare we're talking about. If we're talking about original Medicare, where you just have plain Jane A and B and D, well, it covers it. The only thing I don't like about original Medicare is there's no maximum out of pocket. So if you get multiple hospitalizations in 1 year, it can financially break somebody. Where most of these Medicare Advantage plans have a maximum out of pocket.
And either way, there's a 20% co-insurance on chemotherapy drugs.
Correct.
So
Wow.
if a drug costs, $10,000 per dose, you're talking about $2,000. And most of these Advantage plans, you get to $6,000-$7,000, it cuts you off. You're not going to pay any more money.
Well, and we'll skip down to on Part D. Right now the true what it's called the TROOP, TROOP, is actually a maximum out of pocket for your drugs. For 2026, it's $2,100, and the maximum deductible is $615. So once you reach that $2,100, you're done paying. Now 2027 is $2,400, and they moved the deductibles up to $700. But sorry, I'm getting ahead of myself. I think that's like on down the road, one of your questions about D.
No, but you know what? Let's go ahead and talk about Medicare Part D.
Okay.
Because it is, I keep seeing it all in the news.
Well,
It comes to 27, it's going to cut. You can't get your medicine and all, putting all this fear in folks, seniors. You can't pay for your medicine. So let's go on to Part D.
Okay, Part D. What's going on right now is they basically had Part D is not going away.
Okay. I'm glad you clarified that. Okay.
They basically had an expiration of the temporary federal subsidy that was holding down the baseline premiums and deductibles.
Okay.
So basically that part went away. So now, as you see, if folks have original Medicare, or if they have a supplement, a G or one of those, they always have to have a Part D with it. See, the Medicare Advantage plans, it's included.
Yes, it is. Yeah.
But when they have original Medicare or a supplement, they have to have a Part D. Now, those Part D, it's probably going to rise some costs this year. It's probably going to cost an extra $20-$30 more per month on the medications because they let that temporary hold go away. But Part D is never going away.
Okay.
And I don't actually see the Medicare Advantage or the supplements actually going away. Actually, last year, I was reading yesterday there was an 18% increase in folks who had supplements, the G and the F and the N, those lettered supplements, which are kind of spendy. There's an increase in those, and they don't have the drug coverage, so you have to have D to go with it. Now, have they decided to stop paying all the Medicare brokers for Part D? Yes, they have. So do I do it? Yes, I still do it. I do the homework. I do all the legwork. I have some folks that are like, hey, I'll call, just tell me what's best. So I'll run down through it and, okay, this is the best one. Here's the 1-800 number for them. And it's not really, I wouldn't really call it fair from my perspective, because it don't get paid a whole lot on a drug program. But at the same time, if I write it, I am legally responsible for it. So it goes, if there's a problem, it would go against my errors and omissions insurance.
I have a question. I don't know if it's off of this bill or not, but I'm having an issue getting a medication They'll tell me it needs to be pre-authorized. And then when I go to the pharmacy, they're saying, no, we don't do that. Your doctor has to do it. You go back to your doctor's office. They said, I already sent that in. So it's like, is there a way you can cut through the chase? I mean, I've called TRICARE, I've called Medicare, and then I'm still back to TRICARE out at
And
George A.
TRICARE is your
Schools
primary on this? Is
on
TRICARE
this.
the,
Yes.
okay, so TRICARE is the primary. Okay, so
I have United Health, and United Health said, no, we're not into that because we don't cover any medication. So
correct.
go to TRICARE. TRICARE said, well, I needed this from your doctor. My doctor's telling me, no, I already sent that in. So it's like, do you guys even
It, it,
talk?
is your doctor on post?
No, it's a civilian. And then what it was is like the Omnipod 5. They'll approve it for the 4, but not the 5 because I'm a type 2, not a type 1. I don't get that. I mean, if you need it, you need it.
I don't disagree with you. And it could be, I've seen on prior authorizations them, well, we put it in, And I'm like, you put it in, but you didn't give a good enough explanation for them to sway it one way or another, especially in your case.
So I need to go back to the doctor. What you're
I
telling
would,
me.
I'd say, hey, can you send me what you sent them?
Yeah,
And then I'd call
exactly.
TRICARE and say, well, what more explanation is needed here? And,
Yeah,
and and unfortunately, a lot of times that comes down to you because I call TRICARE, they tell me to fly a kite,
yeah.
and
So I
so
want to
does
talk to the
Medicare.
pharmacist. Okay. It's frustrating. But anyway, yeah. So it's a lot. Um,
I got a question, Bill.
well,
With this change for 2027, we will be notified by mail of any adjustments for
You,
Part
you,
D,
you,
correct?
you will, and that should come out in your annual notice of changes. And technically,
mhm.
you should have that by September 30th.
Okay.
And
Oh,
which I'm not sure why they send out annual notices of changes by September 30th, yet they won't let me talk about any of the 2027 plans till October 1st.
Oh, wow. Oh, boy.
Yeah,
No.
if I was to talk about them, boy, they'd get me. They yank your license for that.
oh
Oh,
wow.
okay. Oh, wow.
And
So,
I've seen some of the first looks, so I think some folks are, especially my low income folks, are going to be shocked. The benefits are better than what I was expecting across
oh,
the board.
Well,
really?
that's good. That's good to
Yeah.
hear.
Yeah,
Yeah.
that is. Yeah, that is. And what to make changes, what is the date that we need to remember in November? Is it November?
No,
That no?
October.
annual election period starts October 15th
Okay.
and it ends December 7th.
Okay. Ends December 7th. So
Yeah.
that's the window that if you want to change up, you need to be aware of that. Okay. That's I
Yeah.
just wanted the audience to know that deadline date and time. Okay. Thank you.
Yeah. The only exceptions to that are some folks who are on Medicaid or
Mm-hmm.
if somebody's in a facility. If
Mm-hmm.
somebody's in a facility, I can change them any month of the year round.
Oh, okay. That's
Now,
Okay.
good to know.
do I
Mm-hmm.
recommend a bunch of changes? No. But if
Mm-hmm.
something changes, if they move facilities or if they get a new visiting physician who comes in, then yeah, changes
Okay.
we can make.
That's good to know. It's good to know. We kind of talked about this. Unexpected illness, dementia care, cancer care, kidney transplant, dialysis. Um, Medicare will cover the majority of unexpected illness like that, or is there a time limit on coverage?
They'll cover the unexpected illness itself. Other than I know one of yours was dementia.
Mm-hmm.
A little bit of help there, but not if they're in a facility. They pretty much got to be down to Medicaid to get the full
Oh,
amount.
okay, okay.
And it's
Mhm.
not hard when you get into a facility to go down to Medicaid. I've seen a lot of folks who had a pretty good income, and all of a sudden they get in a facility, and facilities aren't cheap.
No,
Even
they not.
well,
Mm-mm.
even adult family homes right now, they're every bit of 12, 13 grand a month.
Yeah,
That's
depending
right.
on
They
level of
are. They
care.
expensive. Yeah.
That's outrageous.
Well, and also in the same token, since I am on the adult family home council, they have just been pay cutting them every year. It's
Mhm.
hard. It's hard for a lot of them to stay in business if they only have Medicaid clients.
Mm-hmm. Mm-hmm. I can see that.
So
Yeah. Go ahead, Gloria.
Medicaid, Medicaid, you said go down to Medicaid. So what are the requirements on that? I
Well,
mean, like you say, if you had a nice income before, and now you have to go down to Medicaid. What is that? You've used all of your resources, all of your funds?
yes, ma'am. Yeah,
Oh,
yeah. It's when you like. I have a lot of folks who go into a facility, and they'll if they have a house, they're going to be private pay until that house,
it's
Oh,
they
so
put them
wow.
on
hard.
Medicaid, but then as soon as they sell the house and get that money, they're back on private pay.
Wow.
They go back and forth. So if you're on street level, not in a facility, right now it's at 17,
1860,
1860,
1870 a month.
If you make below that, then you'll qualify for some portion of Medicaid. Now, when we're talking about those numbers, 1780, 1800 bucks. That just means they're paying your Part B premium.
Mm.
To get full Medicaid, you've got to be below 1100 a month.
Or
What?
clinically needy.
Wow. Wow. Who can live on
I mean,
1,100 a month? Oh
that's the
boy.
homeless.
No, no, no. Most of the homeless making more money than that.
I know
Wow.
you kidding me.
No.
Boy,
Well, then
this is
what's
a
this with the
reality.
no shelter?
It's it's it's
That's a choice?
it's pretty spendy.
Wow.
Wow.
Live and learn. But
And back to your statement, where you said when you get in this situation, and if you got a house, could you clarify that or talk on
Well,
that?
if you move into a facility and you have a house,
Mm-hmm.
but if you've got some stuff wrong with you, they'll typically put you on Medicaid because you're still paying for that house. But then once that house sells, they'll move you into private pay. They'll take away your Medicaid until you spend those funds and
then you
get back
spend
in.
that.
Wow.
Yeah.
And your primary residence as well as your primary vehicle are exempted from counting against you when you're applying for Medicaid.
Okay.
So if you're close to that limit, and sometimes if you have a couple houses and you're close to that limit, it's going to put you over. But if you live in the house that you own,
Yeah.
they won't count that against you when you're applying.
That's good to know. That's where the clarification is. If that home is your resident, that's the difference. Okay.
Yeah,
But if you
and unfortunately, on those rules and regulations, we don't set those. Those are all
right,
determined by DSHS. Um,
right.
Now, if somebody actually doesn't live in a facility, let's say they live in, we'll take Mercy House, which is
Mm-hmm.
low income senior living.
Mm-hmm.
They're not in a facility. We can help those folks to get on Medicaid if we know their
Okay.
income and they choose to want the help. But I say anybody that's that low of income definitely needs to get on Medicaid. I mean, why not
Absolutely.
save yourself $100 at least in Part B?
Absolutely.
Yeah.
Absolutely.
I just have another question. I don't know if I can ask this on here, if I need to ask you in private, but I had also heard that if you're ill and you have a home, and if you sign that house over to like maybe your child or your kid or your loved one, then
Good question.
they can't bother your home because that's not your
Mhm.
home anymore. That's you've signed it
They have a
over. Okay.
5-year look back period.
5 years, is it? I thought it was 2 years.
No, so if you're planning on doing that, quick deeding your house to your children or,
You better
whomever
do it
else.
before you turn 60.
Yeah, it takes a lot of prior planning on that front, and most people don't think about that until they're, closer to that position.
No, and who would want to at the age of 59?
Yeah, yeah.
I'm 56, and I'm not giving it to him.
Mary has a question, Bill.
Yes, ma'am.
Will it affect people that have their home in a trust?
In a trust.
It's going to be
Yeah.
a elder law attorney question.
I know that there are some types of annuities and some types of trusts that are also exempt from counting against you towards Medicaid.
Okay.
But that's an attorney question.
Okay.
Yeah.
Okay. All right.
And I'm always looking for another good elder law attorney because I always have people to send them.
Do you know
Okay.
some legal, some lawyers to do with
Elder law?
mhm.
Yes.
I know one over in Kitsap.
Yeah.
But as far as this area, Tacoma area,
My grandparents used Turnbull and Associates, which is now renamed under something else, but they're in downtown Tacoma, and they did both my great grandma's and my grandma's wills. So
Okay. Boy,
Oh,
you guys have given us a lot of information.
I think we gave you a lot of
thank you,
questions.
Levi, for that.
Yeah, but it's good to know. And Bill, during the course of this interview, you said somebody if you need somebody to help you fill out the paperwork. I forgot what we were
Medicare,
talking about. Is it Medicare or is it Medicaid you were
Medicaid, I
saying?
think you said.
Yeah.
Well, we can help do the paperwork on Medicaid, but on
Okay.
Medicare, if folks are turning 65, I'm happy to walk them through it.
Okay. That's what
That's
I wanted to know.
yeah,
Okay.
that's one thing that Medicare won't talk to us, unfortunately. They'll only talk to the client or a
Okay.
POA or guardian, if that's the
Okay.
case. But
Okay.
it gets kind of sticky, especially folks who
Yes.
just starting their A and then they wait to retire because they got employer insurance. I'm happy to send them the forms on that and tell them,
Okay.
hey,
So you do have the forms. Okay. That's good to
yes,
know
ma'am.
that you
Yeah,
you could help a client that way
I'm
with the
happy to send them
with the
forms. I'm happy to
paperwork.
check them too. We check them and
Okay.
we
That's
fax them.
awesome.
Yeah.
That's awesome that you can help with that process. That's good to know. Thank you. Thank you so much. Uh, what your company, can you tell us a little bit about your company and what we just said, how you what things that you offer with
Yes,
your
ma'am. We offer Medicare Advantage plans. We do Part D plans. We do all the Medigap supplement plans, F, G. Well, not much of F because you got to be born beyond a certain date to get F. They don't put you in that one anymore. It's kind of
mm,
expired. And I have a gentleman who does all the ACA plans for younger folks who are still working but may not have employer insurance.
right.
or any ancillary products. So cancer supplement policy, a
Hospital indemnity.
hospital indemnity. So if you're in the hospital, it'll pay out a certain amount of money.
And
Usually we match that to what your plan costs. So if it's $500 a day for costs, we put you on an indemnity plan that'll pay you out $500 a day for when you get in the hospital.
Those indemnity plans are the quickest way to bulletproof any Medicare Advantage plan. Because if you look at any Medicare Advantage plan, the biggest cost of it is that hospital stay per day for the first 4 to 5 days. That's the harshest part. But I do like the Medicare Advantage because they do have a maximum out of pocket per year, anywhere between $5,900, $6,700. Once you're there, you don't pay anymore. So
Yeah.
Is there a big difference between that one and United Health? Are they pretty much the same?
well, we'll take United Healthcare alone, Pierce County. They have 13 plans.
Yeah, 14, I think, next year.
These Medicare Advantage companies. They're all allotted the same amount of money.
Mhm.
If you start looking at plans, they're tailored towards different things. They put the money in different buckets.
Different stuff. Oh, okay.
Yeah, because everybody's need. That's one thing I will say. Everybody's needs are not the same,
That's true.
and that's a big thing about. That's why I'm not a big proponent of somebody getting on the phone, signing up for a plan. You're never going to talk to that person again, for
Yeah.
one thing, and you're not going to get help. So a needs analysis needs to be done, especially now with the network issues. That's a huge thing for us even.
What about the health fairs? The information in health fairs, are those a good one? If you see an agent there, that's
Sometimes those are good if they're a local agent.
uh-huh.
My problem is I used to be what we call a captive agent, and I only worked for one company. And I worked for them for 2 years, and it was Molina. And Molina only had a low income plan. But as a broker, I have I think 12 or 14 different plans,
Different
Okay.
carriers.
different carriers to work with, not just one carrier.
Right.
And that's why if you have somebody set up at a health fair, if it has an agency name on it, I'm all for it. But if it has just a carrier name, I'm like, well, they're there to sell that brand. And one client, Humana might be better than United, or WellPoint might be better than WellCare, or vice versa, just based on the client's needs.
Bill, ACA, that's the Affordable Care Act, correct? That's Obamacare, or the trade name Obamacare.
Yes, ma'am.
Do you help people enroll in that also?
I have one of my guys in Olympia who does
Okay.
that specifically, and we send all our folks who need ACA help to him.
Okay.
I did do it several years ago, but
Yeah.
I just was like, I just want to stick with
And that's
this.
okay. Yeah, but you're knowledgeable in what you're doing, and so people need to know what your information too. They sure
Because
do.
you could refer us on to someone else if
Yes,
it's
ma'am.
not
Yeah.
something, they used to
Right.
do.
Right. Well, Bill, wow, it seemed like I still got some more questions.
Come
This
on.
topic is evolving
Yes,
constantly,
yeah.
but you need to be update on all this stuff, and I'm glad that you and your son are available to help in all areas that we discussed today, and that you guys are really informative. We appreciate you. Well, any more questions, Gloria or Mary? You have any more questions? Anybody? I was just looking at the clock. It says 12. So I was
I don't
just
have any more, Bill, unless we'll see you at Mercy House. Whenever. If we
Mary.
need
Mary
help.
may have stepped
Actually,
away.
he goes there most of the time now.
Oh, okay. Oh, good. You
Levi hangs out.
mentoring. Oh, okay. You really mentoring Levi. That's all right. That's wonderful. Mary says, thank you. Good information. Okay. Well, on that point, we might have to do part B, or maybe we could do with Mahogany later on. Maybe you could just come and do a in-person presentation with the
We
basics, and
we
then
could do
also,
that. We could I could gather up some information on some of the different cancer plans if you wanted to go down
yes,
that road.
yes.
That would be helpful.
Yeah, that would be helpful if you could do that. Yeah, we need to know
We
that.
sure can.
Okay.
Thank
All
you.
right.
Thank you,
All right.
guys. Thank you
Well,
for being on
today,
our show.
yeah,
Thanks, Miss
thank you
Gloria.
for being on our show. And today you have Uh, our guest today is Bill Harrison and Levi Harrison, Medicare Specialists. They're good friends of ours. They're in the community. They are very informative. If they don't know, they'll go find out, and they're here to help you to understand the Medicare system and other plans that can help you. So we're going to get ready to sound off. Um, Bill, one thing, what would you like to leave with the audience today when it comes to Medicare?
Well, when it comes to Medicare, I would definitely say it's best to have a local agent,
Okay.
because if you call, you get trapped on the phone by one of those
Sure
phone
do.
junkies.
Yep, you do. Yep.
And I
Yep.
have clients every year. They'll call me January 1st and say, "Hey, Bill, I made a mistake. Hey, I got on the phone with somebody. Now I can't see my doctor. Now my drugs aren't in network. Now my doctor's not in network, and then I fix it, but then it can't change till like February 1. So it's January, February, March are basically called OEP. They don't advertise that as a Medicare period, but if you're in an Advantage plan, you made a mistake, that's the time to fix it.
Okay,
January,
that's good to know.
February, March.
Yes, ma'am.
Okay,
Okay.
that's good to know. Thank you, Bill. That's good information. So we appreciate you. Thank you for being our guest today to give us the update on Medicare insurance and repeat the date for changes again, starting.
October 15th
Okay,
through December 7th.
October 15th to December 7th. So
Yeah, so
audience, remember that.
it's
Yep.
not a rush. I
Mm-hmm.
call it the 7 weeks of hell, but it you don't have to make a decision October 15th. At least
Okay.
talk to somebody, get some plans laid out in front of you, see what best fits your needs. That's the way to go about it.
Okay.
And
Awesome.
it might be in a great plan. And I'm one
That's
of those
true.
guys. If you're in a great plan and it fits all your needs, then I'll shake your hand and say, hey, call me if something changes.
Okay. Thank you, Bill. And
Right.
also your contact information, your website of
It's
contact.
I got email and phone number, but it's 253-255-3962.
Okay.
And my email is Bill, Medicare Specialist at gmail.com.
Okay.
And
All
yes, it's
right.
way too long. I regret it every time I have to write it.
But that's okay. It's basically your name and Medicare at Gmail.
And I'm
So
usually pretty prompt on getting back to folks. If I don't get back to you, somebody will out of my
yes,
whoever's
you are.
closest to your area. So
Yes, you do. You respond, and we appreciate that. Well, thank you, Levi. Thank you, Bill, for being our guest today on the Mahogany Show podcast. We really learned a lot. Gloria, did you want to add anything else before we close out?
Just one quick question. Are you just Pierce County or are you King
no,
County
ma'am.
also?
No, we cover
Pierce.
Washington, Oregon, Idaho.
Oh, wow.
Actually,
Okay.
we have Arizona and New Mexico.
Colorado,
Yeah,
Missouri.
we're in quite a few places.
Okay, that's good to know, Bill. That's
I
good
have
to know.
2 agents in Missouri. My brother owns a 2 PNC offices. They do home, auto, life, but they also do Medicare now. So they've joined us. So
Okay,
Oh,
that's
okay.
awesome.
That's good to know.
That's good to
You're
know.
all
Yeah.
over the Northwest.
try
Yeah.
to.
Yeah. Yeah. That's awesome. All right, then we're going to close out once again. Thank you to Bill Harrison and Levi Harrison, Medicare Specialists. If you need any help, need any information, they are the guys to contact. And so once again, you have been listening to the Mahogany Circle of Hope Show podcast. Everyone have a great evening, a great afternoon, and a great week. Have a great day. And thank you, Bill and Levi. We'll
Thank you,
see
Thank
you
you.
ladies.
next time.
Thanks,
Thank you
Thank
so
you.
everybody.
much.
All right.
Enjoy
Thank
the
you.
rest of this beautiful day.
Yes.
Thank you.
You as well.
Yes.
All
All
right.
righty.
Bye now.
Bye.